Why do proven health interventions fail to have their expected result if you're in a resource-poor setting? Why do established programs lose effectiveness over weeks, days, weeks, or months? Why do tested programs sometimes exhibit unintended effects when they get transferred to a new setting? And what a lot of us have been talking about and thinking about is how can we take multiple interventions and combine them to capture cost efficiencies and to reduce the splintering of health systems into just breast or just malaria. One of the challenges that we have is really having resources to get the data that we need to know are we implementing things well. And I found this very interesting kind of fiber art pie chart that was published. I had an opinion paper in the Scientist, Bob Grant, in 2008, and looked and said of the more than $5.2 billion that the Global Fund has awarded for AIDS, tuberculosis, and malaria programs since 2002, only 3%, or about $158 million, has been dedicated to evaluating the outcomes of these programs. And it was noted in this paper that the Gates Foundation, when he was trying to get the data for this, said that they don't even have the data about how much of their money is going to monitoring. So 158 million looks like a lot. If any of you have ever run a study, you know that it's not enough. So how can we learn to effectively implement delivery of healthcare in resource-poor countries? The way we approach this, the way we approach a lot of things in the United States, we start a new academic discipline. And that academic discipline is implementation science. And it's been brought up several times. I think that there are many definitions of this, but I think the one that works best, for me at least, for developing countries is that implementation science would develop a scientific framework to guide healthcare and implementation and delivery in developing countries. And I think everybody who's doing this and planning educational programs is looking at this as a very interdisciplinary and systems-oriented process, and that it includes health, obviously, the field of health and healthcare, education, engineering, business, social science, and very importantly, information technology, because it's so clear that the internet is going to provide the means to disperse information, to gather information and data, and to analyze information and data. So it's a very important component. And I put this up here because I think you'll see in the talks that are coming forward this morning, they really are hitting what pieces of this, and they're experts in all of these fields that are going to bring their expertise in their field to bear on this implementation issue. So I'll just end with, rather than a summary slide, I'll just give my opinions as kind of a start to what might be said in the, as we go into our panel. I really think that strategies for global health must include stated and measurable outcomes. And that doesn't mean that it has to be a randomized trial. It just means that somebody has to state what the intent is. If you're going to build a bridge, then state that it's a bridge and where it's going. And the key to successful healthcare delivery will be having the data upon which to form and test the next innovation or stage of implementation. So I'll end there and welcome all of the rest of the speakers, because I think it's going to be great. Thank you.